Beginning. Hello and good afternoon, everyone. I'm Laura Monteverdi, and we are here live on KRK and Fox 16. And we have the pleasure this afternoon of chatting with Governor Asa Hutchinson. Thank you, Governor, for taking some time out of your busy day to chat with us. We appreciate that.
Good to be with you, Laura, as always, so thank you.
Yeah, thank you. So I want to jump right into obviously the thing everybody is talking about right now, and that is the coronavirus. We have had our first case about 7 months ago, a little more than 7 months ago. And I just kind of want to ask you, do you think, when you look back, did you think that we would be here at this point? Our lives have drastically changed, not just in Arkansas, but across the country.
It's one thing to hear the scientific evidence that the coronavirus could extend this long, but it's another thing really to absorb the reality of that. And so back in March, whenever we had our first case, I know Dr. Nate Smith called me to the side and told me how long this could go on. And I was rather stunned by it at the time. But of course, you do listen to the science of it, and while it's had its ups and downs and its frustrations, I'm really so proud of the Arkansas people as to how they've responded to it with perseverance, understanding the challenge that we face, and we're pulling through it because we're doing it together.
And that kind of leads into my next question, Governor, of how do you feel as a state we have handled this crisis?
I think we've handled it well, and I'm not speaking of leadership as much as I am the people of the state, that first of all, they recognize that you have to listen to experts, that this virus is serious whenever it's impacted so many different communities and families. People of Arkansas are taking it seriously. And then they are understanding the science as to the importance of distancing, trying to avoid the spread of the virus, and they've listened to leadership. So I'm very grateful for what they've done, particularly our healthcare community, as they have responded with such care and love for the patients. It's been so long for them. They've been out there and they continue to fight this. So the way they've worked together is very, very impressive. As a state, we've done well, but you can't brag on numbers or anything like that, because whether you're in Louisiana, Kansas, Oklahoma, the virus is just out there, and it moves, it seems, as its own will, and all we can do is take the precautions and try to have the right balance in life as we go through it.
Yeah, and speaking of the numbers, we look at those every single day. Whenever you come out with your press conferences, those are what people pay attention to. And I think lately what's catching people's eyes are the number of deaths increasing in the state. And just looking since September 1st, aside from one day in October 2nd, when we had 7 deaths, every day since then we've seen deaths in the double digits. And that is concerning. Is that concerning to you?
Oh, it's not only concerning, it's a real heartache every day when I see those numbers. And of course, I inquire as to what do we know about these individuals, and regretfully, so many of them are elderly, a vulnerable population, and we see it spread across the state. So it is a real heartbreak, and every day that you see those numbers, it reminds you that whenever you have an increase in cases, that means you're going to have more hospitalizations, and that means you're going to wind up having more people on ventilators, and you're going to have more people dying from it. So it not only hurts me when I see the deaths, but it also scares me, worries me whenever you see the number of cases, because you know where that leads. Even though most recover, even though most are not going to lead to hospitalization, some do, and then some lead to ventilators. And so it is a real heartache, and I'm just like every other family in Arkansas. I can count a number of people that have been close to me that have lost their lives because of that. And so it is a heart-wrenching thing when you see those numbers.
Yeah, it does seem like it's hitting closer to home for so many than maybe it was back in March. And again, we look at those numbers, and according to the White House Coronavirus Task Force, they just released a report on October 11th. Arkansas ranks 2nd in the nation in these new COVID-19 deaths per capita, just behind North Dakota. That is pretty startling statistics for us here in Arkansas, because when we feel like we are making headway, we have a statistic like that, and it doesn't put us in such a great light. So what are your thoughts on that?
Laura, I did receive the report, and I believe that's in reference to the last couple of weeks in terms of the growth of cases. If you look at overall in terms of our per capita deaths as a result of COVID, then we move way, way down. And so we're right now, though, because after Labor Day, we had a spike in cases, hospitalizations. We're seeing an increased number of deaths as a result of that. And that trend will continue if we do not get that caseload down. And so my reaction to it is, it tells us we've got a lot of work to do. What's just as troubling to me is that for a number of weeks, we've been going down in our positivity rate, but then in about the last week, it edged up just a little bit. And I don't like that, because we're testing a lot, explain some of the cases that we have, but that positivity rate, I want to see that go down some more.
Now, you said on Tuesday that rolling, back into this, this reopening where we close down again, that you said that's not an option. Do you foresee that being an option in the future if we continue on this track, or are you confident that we will not have to shut down fully?
Well, of course, in theory, everything has to be an option whenever you're looking at the unknown in the future. But what I said, what I meant by saying that is that we're restricted out. We've done what we needed to do, but really the ultimate response to this is individual responsibility, social distancing, trying to avoid groups that are not careful, and that's how we stop the spread of the virus. We're beyond the point of saying we've got to close businesses or shelter in place, which we never did in Arkansas. And so you don't know what the future holds, but I want to put my hope and confidence in the individual responsibility of Arkansans to govern their own behavior, to be responsible for their loved ones and others. That is why we can avoid the other social harms of you don't want to stop school, because that's so critical to our young people, and the social activities even, and then the work. And we want people to go back to work, not to lose their jobs. So there could be an economic crisis of even greater proportion in the sense of harm to people emotionally and their mental health. So I think we've got to maintain that balance, and that's the reason I'm saying that we don't want to have to put more restrictions on. That's not the direction we need to go. We all need to take responsibility and learn what we need to do and do the right thing.
And Governor, as if COVID was not enough, now we are entering flu season. And I know a lot of people, a lot of Arkansans have concerns about that. People go to the hospital for the flu if it gets bad enough. Are you concerned about our hospitals and in particular our healthcare workers who are already inundated with COVID-19?
Well, it's certainly a reminder that as we go into the winter, that whether it's Dr. Fauci or whether it is Dr. Romero, there is a concern that we will get hit with a double dose of the virus, the COVID as well as the flu, because sometimes the symptoms overlap. And so you're going to have people going in not knowing what they have. We're going to have to make sure the testing's available. But you can reduce that worry and that potential by getting a flu shot. And so if everybody goes out and gets a flu shot, then that helps us a lot to get through this winter. I've had my flu shot, and everyone needs to be able to do that. In terms of the hospitalizations, we have seen the numbers go down the last 2 days. We'll see what those numbers are today. But we do have hospital capacity, but we don't want to be in a position of saying we've got to go to a surge capacity. We've got to restrict others from going to the hospital to get the help that they want. And so we have adequate hospital space, but we want to reduce the hospitalizations as a result of COVID.
As far as mask wearing, do you feel that it is working? You know, there are some people who say that it doesn't work. There are others who are on board with wearing it. What are your thoughts on this?
Well, it's listen to the science, and the science is that if you wear a mask, you're going to protect others from getting the virus from you if you haven't. Then there is some level of protection when I wear a mask, even for myself. And sometimes I'll wear a double layered mask if I'm in an environment that I worry about more. And so there is the benefit from wearing the mask, but primarily it is to help others. But even beyond that, it's social distancing. You know, here in my office, we keep people 6 feet away. We wear a mask. We have meetings. We do the work that we need to do, but we're just careful about what we're doing. And as to whether our Arkansans are doing better, absolutely, no question about it, because particularly after what we saw, what happened in the White House, the worry about the President of the United States getting COVID, you know, people said, if he can get in the White House, he can get anywhere. And so people are trying to do better about that. I really appreciate the Municipal League, municipal officials that are reaching out, trying to educate the citizens in their community. By and large, though, Arkansas is doing well. We just can't give up and get lax or, you know, careless about this.
And Dr. Fauci did call that a super spreader event at the White House. Do you feel that was irresponsible to have that event at this time when cases are so high across our country?
I'm not going to characterize it. What is important to me is that if we have public events, that they meet public health guidelines. Generally, that is socially distancing. I mean, if you go to a Razorback football game, you have a mask on and you're socially distanced. We're doing all we can to continue these activities. If we have a political rally, we want to have the same principles in place for our own health, but also to set the right example for the American public, for Arkansans. So we try to be careful. There's always, I mean, the White House is a much more protected environment. I went there, I got a COVID test before I went in to see the president. And so I think people got too reliant upon those measures versus taking the extra step of the distancing and the wearing of masks. Hopefully that will not happen again.
And Governor, I know we are almost out of time with you today, but I want to ask you kind of a personal question. You know, everyone wants to leave a legacy behind, as I'm sure you do as well. You know, this has become a huge part of you being governor, this coronavirus. How do you feel about that? Do you feel like this is going to be part of your legacy? And what do you want to be remembered for when it comes to the handling of this virus?
Well, the most important thing about leadership is that the people that you're leading trust you. And we're going to get through this together, and I'm grateful for their trust. And I hope that I can do everything to justify that. In terms of legacy, you're right. I mean, it was computer science. It is a creation of jobs. It is improvements in job creation. But here we have this challenge that nobody asked for, that I have to address, and we're doing it. And I hope that what people, when they look back on this, is just simply said, he listened, he did the best that he could, he led, and tried to set a good example for Arkansas, and let us pull together to get through this.
And Governor, is there anything else you would like to add to the people listening online right now?
I want to thank you and really the media, because we can't communicate without the media giving us a voice and an opportunity, and that connection with Arkansans, letting them know day by day what is happening, not hiding anything from them, is a critical part of what we're trying to do and what we need to do to stop the spread of the virus and to be successful. This day will end when we get a vaccine, and we're looking forward to that opportunity to get things back to normal. In the meantime, let's just keep doing the best we can every day.
Thank you, Governor Asa Hutchinson, joining us online on KRK and Fox 16. You can hear more from the governor tonight on KRK and Fox 16. Thank you again, Governor. We appreciate you taking time out of your busy schedule today.
Thank you, Laura.